Testing and contact tracing continue to be two of the keys to stopping the spread of COVID-19.
Which is why some medical experts are a little puzzled by some new CDC guidelines that could lead to fewer people being tested. Jason Berry explains.
We've been hearing for weeks from state and federal health officials that if you come in contact with someone with the coronavirus, that you need to get tested yourself. Well, some new guidelines from the CDC say you may not need a test after all, and that's creating quite a bit of controversy. COVID-19 test sites have popped up all over the place, with more and more people wanting to know if they have it and whether they're at risk of spreading the coronavirus to others. The U.S. Center for Disease Control has said individuals should get tested if they suspect they've been exposed, even if they aren't showing any symptoms. This week, the CDC changed its COVID-19 testing guidelines to say some people without symptoms may not need to be tested, even if they've been in close contact with someone known to have the virus.
Those of us in the front line, we should be getting tested twice a week.
Dr. Bradley Dreyfus is an emergency medicine physician who doesn't think what the CDC did makes any sense because reducing the number of people tested will make it harder to stop the spread.
Especially if we are talking about the strategy being test, trace, and treat, which if we're not testing, how are we going to know whether it's safe to open our universities, our cities, and our economy generally?
A number of medical experts across the country are now accusing the Trump administration of putting pressure on the CDC to reduce the number of COVID-19 tests being administered as a way to reduce the number of positive cases reported.
How do you know if you're sick and you're spreading this without a test?
Dr. Ross Goldberg is president of the Arizona Medical Association. He insists the change in CDC guidelines isn't as big a deal as some are making it out to be, because if you think you need a test, you should get one.
Their still default is go talk to your doctor. So my answer to all this is, yes, they said they think not every patient needs a test, but I would still say if you're not sure and you've had an exposure, you should go talk to your physician and they can provide some guidance.
It's unclear what impact the new guidelines will have on the number of COVID-19 cases in Arizona. The hope is our numbers will continue to go down. In Phoenix, Jason Berry for Arizona's Family.